We continue with the diagnosis by 4 phases. The second phase is called the chi phase. In the chi phase, heat evil has entered the visceral organs. Genuine chi and evil chi are both strong. The symptoms are those of their vigorous struggle and strong yang heat. Because many visceral organs may be affected in the chi phase, illnesses of the chi phase show many patterns of symptoms. There are symptoms that are common to the patterns, however. These include fever, heat aversion rather than cold aversion, a red tongue with yellow coating, rapid pulse. There may be the additional symptoms of restlessness, thirst, and dark urine. If heat gels in the lung, there are additional symptoms like cough, chest pain, expectoration of viscid yellow sputum. If heat disturbs the chest and the diaphragm, we also have dysphoria, uneasiness, and restless fidgeting. If heat is in the lung and the stomach, additional symptoms are sweating, labored breathing, restlessness, much thirst, yellow dry tongue coating, and a rapid pulse. If heat presses on the large intestine, we also have diarrhea, chest stuffiness, and delirium. The third phase is called the nutritive phase. In an illness of the nutritive phase, the heat evil is lodged deep inside and the illness is severe. Since the meridians in the nutritive phase enter directly into the heart and pericardium, the symptoms are characteristically those of injury to nutritive yin and disturbance of the heart and the mind. The main syndrome shows as follows: fever worst at night, mild thirst, agitation with insomnia or mental confusion with delirium, faint skin rashes, a red or crimson tongue, and a thread-like and rapid pulse. The fourth phase is called the blood phase. An illness of the blood phase is at the stage where the heat evil has entered deeply into the blood phase. It is the critical stage of a warm illness. The symptoms show two patterns in addition to those of the nutritive phase. If heat in the blood phase is strong and injures blood vessels, main symptom is eruption of a rash or some form of bleeding. The rash consists mostly of dark or purple macules and papules. The bleeding may be hematemesis, hematochezia, hematuria, epistaxis, or hematoma in a muscle. The tongue is typically crimson. If heat in the blood phase is strong and consumes yin fluids, the main syndromes reveal fever with flushed face, dry mouth and tongue, tinnitus with deafness, hotness in the 5 centers, and a depletive and rapid pulse. Thank you for your attention.